record button. Thank you for joining us. Our topic today is all about ringing ears, and it's sponsored by Jennifer Waddell at Sound Hearing Care. And in fact, she and I are your presenters for today. She's the specialist and owner of Sound Hearing Care, and I'm Susan DeBont. I'm a clinical product specialist with a company called Widex. And we're going to talk about tinnitus or tinnitus, ringing in the ears today, and I'll give you a little bit of information on how Widex has approached this as a means of helping you to cope with your tinnitus. Jennifer, do you want to say hey?
Hello, everybody out there. Glad you're joining us.
Tell us just a little bit about your practice in case there is anyone who's not familiar with Sound Hearing Care, where you are and how long you've been there.
Well, we've been in practice since 2015. I have 4 locations here in the upstate: Simpsonville, Greer, Powdersville, and Travelers Rest. And we specialize in hearing aids and dealing with folks with tinnitus. We just moved, so we have a wonderful, beautiful new office in downtown Simpsonville, and we would love to help anybody out there that's struggling with tinnitus. I have it as well, so I've been dealing with that for 10 years now. So I've made it a personal goal to help as many people as I can. I know the struggles that people deal with it. I've been there myself, and it can be a hard road, and we're here to help.
Very good. And Jennifer's very modest, but she's kind of a leader in the field in addressing these kind of issues, because not every office has the investment in the equipment and education and the know-how to help you to cope and manage with your tinnitus. So we'll just jump right in. First, just understand that if this is something that you experience, or maybe a friend or family member, someone you love experiences tinnitus, boy, you're not alone. There's like 50 million Americans that report experiencing some degree of tinnitus. So that's roughly about 20% of all of us. The general population are affected by tinnitus in one fashion or another. Now, little bit smaller group, but still a substantial number of people have it significantly enough that they either seek medical attention, they go to their doctor and ask, what is this? Why do I have it? What can I do about it? And 2 million of those really classify it as something that seriously is interfering with their quality of life. So one aspect to tinnitus that we are well aware of and have been for some time is the fact that about 90% of the people with some sort of ear noise also have some degree of hearing loss. It may be very mild, early stage hearing loss, but the two things kind of go together. So that's why you'll hear Jennifer and I talk about kind of one of the first things that we do is assess your hearing and make sure that we're aware of what's going on with your hearing, because quite often that's what's behind or driving your perception of the tinnitus. And by the way, tinnitus, both ways are considered as correct pronunciations.
It's tinnitus here in the South.
Tinnitus in the South, and tinnitus, I guess, in the Northeast. It's really any sound that you're hearing that isn't coming from the environment around you, it's coming from inside. And so it may be a sound that you're hearing in just one ear, or maybe it's both ears, maybe it goes back and forth. Some people describe it more like being a sound in the center of their head. And there are all kinds of different descriptions. So if you have friends that have it, everyone probably has their own specific kind of perception of it, whether it's a buzzing or ringing, a hissing, a sizzling sound. Some people hear more of a low hum or roaring, more bass tone kind of in nature. For some people, it comes and goes. For others, it's there all the time. And then sometimes it gets a little louder and sometimes it gets a little bit of softer sound kind of intensity. And with as many different types of sounds that people experience under this tinnitus description, there's also the same number of different causes, hundreds of different causes. And of course, the leading kind of cause or contributing factor is some damage to your hearing. The one thing that we do know is there's no one single cure that works for everybody. But there are a variety of kind of therapy solutions that actually have a track record for being proven to offer relief. And so it's the key to figuring out what's going to work for you is to work with someone like Jennifer, who knows about the different variety of solutions and then tries to match the best solution for your particular needs. So just as some of the common causes, we already talked about if there's some decrease in your hearing going on, that's probably going to be one of the biggest factors. And the hearing loss can also be related to exposure to loud sound or loud noise. Now, if you've been exposed to a loud sound kind of suddenly or just in the recent past and your ears have been ringing ever since, there may or may not be any hearing loss related, but that doesn't mean that you might not still have some tinnitus. And sometimes this is temporary and then it finally goes away. Sometimes it never leaves you. So that's why we're always very active, encouraging if you're going to be working around loud sound, like using a power tool, anything that's loud enough that you have to shout to be heard over is potentially loud enough to do damage to your ears. So we encourage you to wear some hearing protection, be careful with that. Now, some of the other causes can be pretty simple and easy to remedy. I mean, it can be just having a cold that kind of settles in your ears, having some allergy reaction and you get congestion in your ears as well as in your sinuses. Maybe even just a simple buildup of wax in the ear canal can often cause an ear noise to start happening. And in most cases, when that wax is removed, the tinnitus or the ear sounds go away as well. Many people have a little arthritic condition in their jaw joint called the temporomandibular joint. And that inflammation is often related to tenderness, a fullness sensation in the ear, and sometimes different types of ear noise as well. And then, of course, there are a variety of different health issues, cardiovascular kinds of problems, even certain medications that we take, say for high blood pressure, and there are often side effects to the medications that can cause the tinnitus to get louder or suddenly become more noticeable. So anytime you have a variety of medications, or maybe even you maybe have noticed that even if you're taking some pain medications for some arthritis and pain discomfort, quite often Tylenol, aspirin, ibuprofen, if you look at the sheets of information that come with those medications, they may list that there are the potential for causes of an increase in tinnitus. And then there are certain kinds of diseases of the inner ear. Meniere's disease is one that often people are familiar with, that usually is known for having some dizziness side effects, but it can also have some fluctuation in hearing and a very noticeable kind of low-pitched roaring kind of tinnitus. So when you go in for an evaluation, definitely we're going to ask a lot of questions about your hearing history, your health history, the medications that you're on, because understanding all of those kind of factors help us to put the pieces of the puzzle together to try to figure out what's happening in your case. Jennifer, I know when someone comes in for the first time to your office, maybe you can describe a little bit about like all of the kinds of history questions and the kind of testing that you might do if they complain about having tinnitus.
Well, we have a questionnaire with a score sheet that has a number. So I was certified by the professionals through International Hearing Society, and I've taken all the training through the certification for tinnitus providers. And we learned to do a questionnaire from the head experts out of the University of Iowa, right. Dr. Sweeney. And so basically I go through the questionnaire. If it's a really high number, we talk about the psychological issues, if they need therapy, if they need to be put in place with a psychiatrist or a psychologist, because it can be very, very serious. So I want to see what scale they're on, number one, with their mental state. And then number two, we talk about their hearing. We talk about their case history, if they're on meds of any sort that would cause ringing in the ears, and how long they've had it. And on a scale of 1 to 10, how much it bothers them. And, when somebody comes in specifically for tinnitus, a lot of times hearing. That's what they always say. But then when we get into the meat of it, and I say, well, let's just rule out hearing loss first. And 99% of the time there's a hearing loss.
Yeah.
Oh, okay. So we check off the boxes, and of course, usually it stops there with the hearing test. And then, let's address the hearing. Therefore, we're addressing the problem with your brain, trying to fix the hearing, which most of the time is where the tinnitus is coming from.
Yeah, I think it's for 70% of the cases, if you address the needs of their hearing and help restore the ear and the brain's ability to hear the natural world of sound, that in and of itself significantly lowers the frustration and the annoyance
Exactly.
of tinnitus. Yeah. So you can see that there's a little bit more to it. And those questionnaires that Jennifer mentioned are real important, because we know that common kinds of struggles that people do have with tinnitus of varying degree can include things like difficulty either falling asleep or getting back to sleep, because of course at night it's a quiet house. So the only sound that your brain is aware of is that internal sound. And that can make it difficult to kind of ignore it and get to sleep. That in turn can add to the annoyance and the irritation. It can even interfere with your ability to kind of listen to conversation and concentrate on certain things. All of that in turn can over time kind of increase the stress that you feel from the tinnitus. And those questionnaires that she mentioned kind of get to the point of, on a certain scale, where are you experiencing the stress related to tinnitus? Tinnitus and stress kind of have this relationship that, for instance, you might wake up on one day and notice that the tinnitus is there, and boy, it's a little bit louder today. And then you get kind of concerned because you think, I have this important meeting. It's going to be real important that I can focus and listen and concentrate. And gee, now I'm a little concerned that this is going to interfere with my ability to cope in that situation. And that extra stress can then physically and physiologically cause you to be a little bit more tense. It can maybe elevate your blood pressure a little bit. And guess what? All of those things can make the tinnitus get louder. So we sometimes get caught up in this kind of vicious cycle, as we call it, of it kind of escalating the stress that we feel on that particular day. And that in turn makes the tinnitus more noticeable to us. So our approach is to also help you kind of deal with the stress and lower the stress reaction that might be going on. Widex, as a manufacturer, was one of the very first hearing aid companies to pioneer this use of sound therapy as a way of helping you to manage the tinnitus. It was introduced back in 2008. And again, no one else in the hearing aid technology field was kind of combining the sound therapy for tinnitus with hearing aids. Over the past decade or so, Widex has continued to kind of evolve its approach and designing kind of a whole therapy program with lots of different resources that can be available to you. In 2020, we introduced our newest family of products called the Widex Moment. And the one thing about Widex is they have incorporated what we call Zen or Zen therapy in with their hearing aids all along during this time. And that includes every style of hearing aid and every technology level of hearing aid, because you can't always predict that the tinnitus sufferer only has certain kinds of hearing problems. So we like to make sure that regardless of whether you want an in-the-ear hearing aid or maybe one of the real tiny receiver in the canal hearing aids, maybe you need just a real basic level of technology to meet your needs, or you have a more significant need for hearing help across a wide variety of situations. Regardless of all of that, we want to make sure that the Zen feature is there for your hearing care provider to initiate and then to kind of design the way that it's going to work specifically to make your needs. And we incorporate, counseling and education, and coming to this kind of a seminar gives you part of that background of what tinnitus is all about, why you might have it, and then what steps can you take to kind of address your needs. Also important, as we've talked about already, letting you hear in a more normal fashion in many cases is enough to really lower the annoyance and frustration and distraction caused by the tinnitus. So that may be all that you need, is just to address that little bit of hearing loss. But for some others, they need a little bit of extra help in kind of managing and living with their tinnitus. So we use in Widex products, we use what's called Zen, which are kind of like these melodic tones that are designed specifically to relax you, to help break that stress cycle. And then we do have certain kinds of help with mindfulness and relaxation exercises as well. And when you put all four of those things together, the success at treating your tinnitus increases significantly. Now, in most cases, people kind of ask, well, why do I need to wear something all day? Why do I need a hearing aid? Well, we need a hearing aid to hear in a normal fashion through all the different listening environments that they were in. And it kind of makes sense if you have tinnitus, even though it may not bother you all day, to have this Zen feature incorporated right in this tiny little ear-worn device that you can comfortably have in all day long. That way, your sound therapy is always available to you. And in many cases, it's there softly in the background. So when you walk into that real quiet room and all of a sudden your tinnitus is real noticeable, guess what? The sound therapy, the Zen, is already there. When you move it back into a noisier environment, you're hearing the conversation and the sounds of that environment in a more natural and normalized way. So the Zen may not be as noticeable, but it can be always there for you when you need it without having to push a button or make changes or activate the Zen.
Hi, Susan.
Yes.
Hi, can I interrupt? We do have a question in the chat box. By the way, I'm Fane Fisher. I'm the sales manager for Widex, and I service South Carolina. I wanted to, so the question is how long do you need to use the Zen for it to start to work on the ringing in the ears?
Well, let me answer from the studies, and then I'll ask Jennifer if that's what she's also finding, in actual practical applications. So
Great.
Our studies reveal that when we fit the hearing instrument, and if we're applying just a little bit of amplification to help normalize your hearing ability, so we're giving the brain some sound stimulation that maybe it's been hungering for, that often can be the contributing factor for the brain generating this internal kind of sound. And then if we add Zen as part of a sound therapy that's there to access, that typically within the first week to 2 weeks, patients are reporting that the annoyance level of the tinnitus is already starting to come down. So some people do get kind of immediate relief. Others, it may take just a few days because we're kind of retraining the brain to learn not to put so much importance on the tinnitus. And for some people, that may take a few days or even up to a couple of weeks. But I would say most of our studies do substantiate that within the first couple of weeks, the annoyance level has gone down. Jennifer, what do you see when you are working with your patients?
It honestly depends on the person. Everybody's different. Usually there's a decrease before they leave my office that day, to be honest with you, for most folks. Some people say, well, I still hear it, but it doesn't bother me the same. Or I didn't think it was working and I noticed that I still had the ringing, but when I really notice it ramping back up is when I take the hearing aids off. So people do finally realize after they take the hearing aid off, oh, wow, it is working. Even though they can still hear the ringing, it's not the same. So everybody's different. Some people it goes away completely. Some people it turns down a notch. Some people a whole lot. It so varies on the person. And honestly, the more high strung you are, the more you obsess about it, the worse it is usually. And so, yeah, because just like, my ears ring all the time, obviously I have it as well. But what's funny is when I'll take these classes and it will make me focus on it. And I notice my ringing twice as bad when I'm learning about tinnitus.
Yes. Yes.
It's the weirdest thing. And I think that goes for everybody. It's just like the secret, maybe what you think about expands. And I think it also works with tinnitus with the ringing ears, because the more you dwell on it, the worse it gets. So we've got to fix it and chill out. And I think that helps a lot, to be honest with you.
Yeah, I would agree 100%. And that's kind of the way that the music has been designed, is specifically to be something that's kind of there in the background. So you don't really focus on it, but it's kind of what we call passive listening. And it's the fact that the brain has this nice, soothing, relaxing kind of musical sound, aside from just the tinnitus, that lets your brain refocus. And you're right, exactly. If we take the attention away from the tinnitus and then we pair it with something that's very relaxing. And the beautiful thing about using music as a sound therapy is I don't have to teach you how to relax from it, right? I don't have to teach your body how to respond. Humans have this natural kind of physiological response to certain types of music. So we can use that in kind of this teaching your brain to habituate to the tinnitus, to put the tinnitus in the background and to chill. So it also allows us to kind of stimulate all different areas in the brain. If we take a look at your brain through like a CT scan, looking at electrical activity happening within the brain, we can actually see that at rest, the areas that you see on the left of the screen there, the yellow and the orange areas, are brain activity when it's quiet and the person is just relaxing. Now, if we simply turn on music, look at how many more orange areas. And those are different areas of the brain that are now responding and active. And what's really interesting is if we try different types of music, classical, rock, you'll find it stimulates different areas in the brain. This is, my guess is probably why, if you have a certain favorite kind of music that you like to listen to, it's probably because that style of music is activating more kind of pleasurable centers within your own brain. So we can use this to our advantage. And we know that if we're careful about how the music is presented and the type of music, we can lower your heart rate, we can lower blood pressure and breath rate, we can reduce muscle tension with music, we can even warm your skin with music. We can actually elicit an emotional response. So here we have to be a little bit careful, because certain music can kind of alert us. Certain music can kind of cause a reaction, like a fear reaction. And here, I think about the movie Jaws. And if you hear the first few bars of the theme song to Jaws, which y'all know, that if you've seen the movie, that can give you goosebumps right within the first few bars. So obviously we have to be very careful about the type of music that we're going to use so we get the right response. Because if we get the right response, it can also release some very positive hormones. And those positive hormones can cause a soothing relaxation response, kind of melting that frustration, that anxiety, that stress away. And that's important to address that as well as the sound itself. Zen tones, I'll just describe, it's kind of like the chimes that might gently blow in the breeze. So there's no like beginning, middle, and end like a song. They're more randomly, softly kind of generated. And this is what lets you kind of passively listen to it. We call them fractal patterns. And we're surrounded by fractals. You know, a snowflake is a fractal, and that just means you can recognize it as a snowflake, but no two snowflakes are exactly alike. No two leopards have exactly the same spot patterns. No two branches of a tree are exactly the same in the way that they are kind of organized and the length and separation of branches. So we're surrounded in nature by fractal kind of patterns. We use this idea to kind of randomly generate these melodies that are optimized for that relaxation response. You know, I dare say that if I played just a song to you all day long, probably by the end of the day, because you'd listen to the same song with a certain beginning, middle, and end over and over and over again, that would be as annoying as your tinnitus. So we use this fractal kind of passive listening, optimized to relax you and kind of soothe you in order to let you have the benefits of sound therapy and for brain habituation to take place, at the same time being something that you can very comfortably be listening to throughout the day. So we use these kind of randomized tones because, number one, music activates all different areas in your brain, promotes this idea of habituation and passive listening, and has this calming rather than alerting effect. So we're kind of hitting two birds with one stone. We're stimulating your auditory system, those areas of the brain that have been missing sound, and we're also applying some stress management. So we get twice the benefit and twice as quick because we're addressing all of these areas. So I want to just kind of summarize with some take-home points, and then we'll see if we have any other questions. And Jennifer, if there's anything else that you want to add to these takeaways, you know, please do. But certainly we know now that tinnitus is such a common phenomenon experienced by millions of us, but the way we experience it can be very different from one person to the next to the next. Most commonly, we know tinnitus is also associated with even early stage and mild hearing loss, as well as hearing loss that's been with us to a more moderate to severe degree or for longer periods of time. There are a number of different approaches that are helpful at lessening the annoyance level, the bothersomeness of the tinnitus. But finding the right approach, the right kind of therapy or treatment for you is the key. And for that, you need someone that is well-versed and educated in tinnitus and related solutions to help you kind of navigate the decision-making process as to what's going to work best for you. And we talked today about Widex Moment and the Zen feature within those hearing instruments as being kind of a really unique but comprehensive way to approach tinnitus therapy and management. Jennifer, anything else that you want to add in as kind of a takeaway?
You do have control over the Zen. So all of the new hearing aids have an app. So we have the ability to control the volume of the Zen, adjust the surroundings versus the Zen. So there's a lot of different ways that you have control over the features of the hearing aids. Again, there are different levels, so there are different price points. So you don't have to buy premium level hearing aids to get this technology, which is important. So if it's mainly the tinnitus that's bothering you and you don't have a lot of hearing loss, we can put you in a basic product and still get the same results. Or if you do have a lot of hearing loss, we address that as well and decide what's going to be best for you. I also teach folks that, you know, stress level is a big part of this, and, you know, having a process of when you go to bed, sound machines when you're sleeping, when you replace one sound with another, when you take the hearing aids off, that's important. And just the key factor here is to deal with it and know that there are solutions and that we can help you. And the first step is to get your hearing tested and find out what's going on there.
Good. And I think you're exactly right. You know, for a lot of people where the tinnitus is really something they're concerned about, just knowing that there are some methods where you can kind of take control over it. And sometimes those are very simple things, as you mentioned. and the technology that we have available to us, having that control and knowing that there's hope that you're going to have some methods of kind of managing your own tinnitus is really beneficial for people to understand.
And don't give up. I mean, there are people like me that
Right.
are here to help you. So we are here and willing to help anybody that wants to come see us.
And that leads us to kind of, well, what are the steps? Oh gosh, I've got this. And yeah, sometimes this really is driving me crazy. What do I do? You've already kind of taken the first step, getting educated, learning more about what tinnitus is, maybe why you have it, and what kind of options do I have for learning and managing and living with it in a more positive way. So attending this webinar today has certainly hopefully given you a little bit more understanding. And of course, the second step is to work with someone like Jennifer, who is an expert in the field and stays on top of what's happening in the use of technology to help manage your tinnitus. So setting up an appointment with Jennifer at Sound Hearing Care, she can do this kind of evaluation, looking at all the different aspects that may be contributing to it. And she can actually let you listen to like the Widex solution and listen to Zen and give you the opportunity to see if that would be something. As she said, some people notice improvement right away. So I would encourage you.
Yeah, we do 2-week free trials, so you can actually take them and try them in your own environment, which is amazing.
So definitely reach out. Here's Sound Hearing Care's phone number, 864-881-1663. And check out Jennifer's website at www.soundhearingnow.com. It's a great website, lots of information on the website too, but you can then book an appointment. So are there any other questions that came in, Thane, that
not as of yet, but I just wanted to let our attendees, move their cursor to the bottom and they'll see chat. And if you click on that, open it up, you can just type in a question, and Susan and Jennifer are very happy to answer your questions. Let's see if anyone has any other questions, but so far, none so far. I think this was great. A lot of information.
Yeah, so we'll be here for just another minute or so if you do have any questions. Thank you, Thane, for reminding me.
Sure.
Type those questions into the chat. If you just move your cursor as you're viewing this webinar, you should see that ability to have either a Q&A or through the chat and type in those questions.
One thing I forgot, the units now are rechargeable. So that's an option. So you don't have to worry about batteries. We do trade-ins for old technology. So if you have an old set of hearing aids, bring them in. We trade them in and give you a credit towards new. And we also have a brand new leasing option where you can lease hearing aids, which will drop your monthly investment by half. And you can have premium technology for 48 months at half the cost. So that's something new we've tried to do. And then you can purchase up to 2 years, 0% interest through Wells Fargo. So there's no reason why we can't address these issues now.
Great, great. And we know that from a lot of the studies that have been done over the past decade or in current studies, that doing something sooner rather than later on is better for your tinnitus and better for your brain fitness.
Exactly.
As well. So, Jennifer's great. She kind of takes all the barriers that might be stopping you from getting help kind of out of the way. Not everybody does that. So I'm very appreciative that she makes the solutions that you need so accessible and easy to get. So if we don't have any other questions, we'll go ahead and wrap up. Again, thank you for joining us. We'll be doing these webinars on kind of a regular basis. So watch for not only on the soundhearingnow.com website, but watch. Jennifer has a great Facebook page too. So watch for those webinars to be available for view again, and for announcements of new educational webinars that'll be up and coming. Thanks again for
Everybody.
joining us.
Look forward to seeing you. Take care.
Okay, thanks.
Bye.
Bye.